Brianna was poisoned later that night. My whole family and I remember that night like it was yesterday. We wake up every day reliving the same nightmare, that she is gone, and that nobody has faced any punishment for taking her away. There was never an investigation. Authorities treated her death as an overdose and moved on. My daughter had her battles, just like every one of us. But her life mattered. Her death also mattered, as much as any of those you have seen on the news recently. The difference is that Brianna's death was never investigated. But we have her phone, we have her messages, we know who gave her the pill, and we know that Brianna thought she was buying Percocet. And we now know that it was fentanyl and that it was deadly. Take a moment to imagine that this was your child. Wouldn't you want their death investigated? Wouldn't you want to see consequences for the person who sold them a poisoned pill? We need to make sure we are putting money towards the investigation of fentanyl poisonings and the drug dealers who are selling it. Fentanyl poisonings do not discriminate. It could very well happen to your child. It could happen to any of our children. April 14th, 2021, that's the day Brianna lost her voice to speak out. But I won't let her voice be lost. I will speak out for her, and not just for her, but for her husband and her son and her siblings. We will not be silent until someone is held to account for these poisonings. Thank you.
Well, thank you everyone for being here. I'm State Representative Leslie Herod. I represent House District 8 in Denver. Hard for me to give my prepared remarks after hearing that. We are here because too many people are dying from fentanyl poisonings. I too share Senator Pedersen's comments. I have a family member also who was caught up in addiction. My sister, who was sexually assaulted, the age of 15, turned to drugs, became an addict very young. We did not know why. We did not know she was sexually assaulted, but we do know that she turned to drugs and stayed in and out of the criminal justice system for about 30 years. I am lucky to say that she is here with us. She is recovered. She's working, she's taking care of her family. But in my heart of hearts, I know that if she went through the struggle now that she did then, that she too would have been poisoned by this fentanyl. Because addicts don't ask first what's in this pill before they're fixed. And folks who are using things like Ritalin or Percocet, they are not intending to die. But because this deadly drug is in every single street drug across Colorado, that is the risk that we're seeing on the streets right now. I have friends who have died of fentanyl poisoning recently. They did not have access to testing strips. They did not have enough Narcan to bring someone back from a fentanyl overdose. This bill marries a public safety approach with a harm reduction and public health approach. We know that dealers, high-level dealers who are knowingly bringing fentanyl into our communities and mixing it into drugs and selling that to our community members, our parents, our kids, our families, they should have very stiff consequences. And those who are addicted, like my sister, they deserve a road to recovery. They deserve real access to mental health and substance misuse supports. They deserve the choice to know if there's fentanyl in their drugs. This bill gets at that, providing testing strips, providing access to Narcan, providing support for Good Samaritans who are just trying to get their friends help. This is not an easy bill. And I gotta say, the speaker has done amazing work to try to get all sides of this conversation to the table, to come up with a solution that's right for Colorado. Is everyone happy? No. But this is a solution that will work. We have to hold people accountable who are bringing fentanyl into our communities, and we need to do more to get people access to the resources that they need. One thing that the governor has mentioned, and has mentioned time and time again, mentioned it in his State of the State, what we cannot do is go back to the failed policies of the past. The war on drugs did not work, but that doesn't mean that we turn a blind eye to dealers and cartels either. We have to provide the resources that are needed to crack down on these criminals, and we have to provide treatment to folks. I was recently speaking to someone who was in community corrections, and I said, what could we have done to keep you from coming here in the first place? And what do we need to do to make sure that you never come back? This woman looked at me and said, I had been struggling with addiction for years and had committed low-level crimes for years, but could not get into this treatment program because I wasn't a felon yet. If I would have gotten treatment that she apparently asked for early on but couldn't afford, her family would have been intact. She wouldn't be in the system today, and she would be, I believe, on that road to recovery that she now is on much sooner. This bill addresses that. And I want to make clear that while no bill is a panacea, this legislature is doing more than just introducing this. We are wrapping around hundreds of millions of dollars in mental health and substance misuse support to people who need it right here in Colorado, a historic investment that we have never seen before, to really get at the root cause of desperation, of despair, depression, and why people turn to drugs in the first place. We're also working to infuse dollars into the workforce because however many beds we put in Colorado, if there's no one there to offer that counseling, that support, that has that training they need to help, it won't do any good. We're also investing in that. So make no mistake, cracking down on fentanyl and saving lives is a priority of this legislature. This bill shows that commitment. But this entire package of work that has been going on for months between the governor's office, the House, the Senate, law enforcement officers who are here today, harm reductionists, and public health officials show our true commitment to ensure that no one else dies from a fentanyl overdose and that no one else is not held accountable when they murder someone in our communities. And with that, I'm going to turn the microphone over to DA Mason. Thank you.
Good morning. My name is Brian Mason. I'm the district attorney for Colorado's 17th Judicial District, which includes Adams and Broomfield counties. Fentanyl is killing our kids. Fentanyl is killing our kids. And it is also killing the parents of our kids. And nobody knows this pain more than the parents who are behind me today and than my community of Adams County, where we had one single incident where 5 people died from fentanyl poisoning. At the moment, it's the largest incident in the country, but it won't be for long. No drug is safe right now. No drug is safe. We are finding fentanyl in cocaine. We are finding it in heroin. We are finding it in meth. We're finding it in oxycodone. And in limited circumstances, we're even finding it in marijuana. Fentanyl is poisoning our kids, and dealers are peddling this poison to unwitting victims. This bill is a huge step forward for holding accountable those who are peddling this poison. Right now in the state of Colorado, we don't have a distribution of fentanyl causing death statute. That means I, as a prosecutor, if I have someone who has distributed a drug with fentanyl in it that causes someone to die, I can't hold them accountable for that death. This bill will allow me to do that. No bill is perfect, and we got lots of work to do. But this bill is going to help us get some fentanyl off the streets, and most importantly, get dealers of this poison into prison, which in this case is where they belong. Thank you. Now I'll introduce my colleague, fellow DA, Gordon McLaughlin.
Good morning. Gordon McLaughlin, District Attorney in the 8th Judicial District, Larimer and Jackson counties. Thank you to Speaker Garnett and Governor Polis on the Colorado District Attorney's Council for working on this bill, and thank you so much to all the families that are here. That means a lot about the importance of this bill and what we are trying to accomplish. In my role as an elected district attorney, and prior to that as my role as a prosecutor with the Northern Colorado Drug Task Force, I have seen the breathtaking rise of fentanyl in our community in Larimer County, and with it, tragically, the rise in overdose deaths. It is a crisis, and it is something we need to act now and act aggressively on. This is a bipartisan bill, and I'm proud to have Republican and Democratic colleagues from the legislature here today, and Republican and Democratic colleagues in the DA community here today as well, whom all agree that action is needed and action is needed now. One of the reasons I support this bill is because this bill gives us the tools, new tools, to make an impact on this fentanyl crisis. And I don't mean we in the prosecutor's offices or we in the law enforcement community. I mean we as an entire community, because it's going to take an entire community to deal with this issue. This bill spans the spectrum from treatment, education, and prevention resources, and tens of millions of dollars towards those efforts, to tools for prosecutors to combat the worst offenders among us. And it's that entire community effort that it's going to take to make an impact on this crisis, because we've frankly never seen anything like this before. The lethality of fentanyl is remarkable, and the growth is remarkable, and we need these new tools to combat it. Allowing prosecutors to prosecute those causing death from distribution in our community is an essential tool that will help every DA's office around this state. There are folks out there knowingly peddling fentanyl, poisoning folks in our community, and profiting off it. And this bill will give us the tools to hold those people accountable, while at the same time preventing and educating those so that we reduce the impact of fentanyl and drug addiction in our community. Thank you.
Good morning. My name is Matt Riviere, and on July 25th, 2021, I lost my only two sons to fentanyl poisoning. Andrew was 21 and Stephen was 19. And my boys were about 20 months apart, and they were good-hearted kids who were just trying to figure out their life. Both had some degree of mental health illness. Andrew was bipolar, and Stephen struggled with anxiety and depression on a much lesser degree. They were the best of friends and worst of enemies growing up. They had a great childhood, and we had a stable and very fun family. We engaged with our boys and had open conversations throughout their short lives. My boys started their drug journey using flavored vape, which turned to vaping nicotine, which turned to pot, which turned to dabbing, which ended with them trying what they thought was oxycodone. It turned out to be counterfeit and was laced with fentanyl. Before my boys passed, tomorrow will mark 8 months. I had heard of fentanyl, but I didn't know anything about it. And it seems since then, every day I read or see an article or hear a story about how this drug continues to take so many lives. And these deaths are not faceless statistics. They are our sons, they're our daughters, our aunts, our uncles, our spouses. They're our loved ones. And every day I see pictures of my boys throughout my home. I see their innocent faces as babies to small, rambunctious boys, to young men who were deeply loved by me, their mom, and so many others. Their urns on my fireplace are a constant reminder of how their lives were tragically and unexpectedly taken from them. And yes, they made a stupid choice. They'd be the first to admit it if we could talk to them today. But they should have never died experimenting with what they thought was a non-deadly drug. They were poisoned. They were killed. And they were murdered by greedy people who have no regard for human life. I know nothing will bring my boys back to me, but I owe it to them to share their story so we can save some by speaking out, raising awareness, and enacting legislation to turn the tide of this deadly evil that is destroying our youth and our nation. We cannot be silent in our suffering. And what we say and do now echoes in eternity. Thank you.
Thanks to everyone who spoke, especially the parents who shared their tragic stories. Happy to take a few questions. Marianne.
Thank you very much. Marianne, politics. Are you open to discussions on changes to the bill? The families have already brought up, the family members brought up money for investigations for situations like hers and like so many other families. Are you open to conversations?
Yeah, thanks, Marianne. Listen, this is the beginning of the legislative journey, and hours and hours of conversations have gone into getting us to this point. There's a lot of people to thank for the bill that's going to be before you, but of course, when it comes to making sure that people have the resources to go after those deadly drug dealers, that those resources are there, I think it's important to know that the cut points have changed in the bill that's before you. The cut points for fentanyl with fentanyl possession with intent to distribute currently are 0 to 14 grams for a DF3, a drug felony 3, 14 grams to 225 grams, which is half a pound of fentanyl compound mixture, and a DF1 for anything over 225 pounds. In the bill that will be introduced, those cut points have changed from 0 to 4 for the DF3, from 4 to 50 for the DF2, and anything over 50 being the DF1. Those are significant changes that will provide the tools to law enforcement and district attorneys to make sure that they hold the people accountable that you heard about, and make sure that those dealers are taken off the streets. But in terms of looking at the investigations piece, and of course, like any bill going through the legislative process, always open to those conversations.
We've already started to hear some of the criticism about this bill. Wondering if this bill goes far enough, and one of the points in particular, those cut points that you're talking about, saying that 4 grams could kill 2,000 people.
I think there's, and again, this is why the education piece is so important, and that's what's in the bill. We are not talking about pure fentanyl, okay? Pure fentanyl cannot be tested by any lab in the state of Colorado. CBI cannot test whether or not this powder, what percentage of it is fentanyl. There are 2 DEA labs nationwide that do drug testing. They cannot test what percentage of a powder is fentanyl. So this idea that we're talking about pure fentanyl is a little bit of a misnomer, and it's important that we provide that education to everybody, and that's why there's an education campaign on the statewide basis, and there's a grant program for community level education. We are very clear in this legislation that we have changed everything to compound mixture. So if fentanyl is found in any substance, if you have cocaine and it gets tested for fentanyl, it is not cocaine anymore, it is fentanyl. And so the idea that 0 to 4 grams of compound mixture fentanyl for distribution with possession with intent to distribute isn't strong enough. We have moved that cut point down 10 grams. When I talked to the District Attorney's Council, and I want to thank Representative Lynch for his leadership in bringing this conversation forward about possession with intent to distribute, the conversation was moving it from 14 to 7. We've moved it from 14 to 4. So anybody who thinks that the tools that we're giving law enforcement to go after these drug dealers isn't strong enough, they are stronger than the people who came to me to begin with wanted to go, and that's because of the seriousness of fentanyl.
Speaker, may I ask a question of the governor?
I mean, I only get to do this a little bit, but yeah, of course, the governor's saying.
Governor Tony Kovaleski with Denver 7. In recent weeks, we focused on an individual arrested with 20,000 pills of fentanyl by an undercover Denver police officer. Within hours, he was given a $10,000 bond, wrote a check for $1,000, essentially a cost of doing business, walked away, and has avoided any accountability. 2 years ago, lawmakers in this very building brought you a bill that you signed lessening the penalties for drug dealers. In hindsight, was that a mistake?
If somebody is caught with 20,000 pills with fentanyl, they should go to jail for a long, long time, and that's exactly what this bill does.
Was it a mistake to sign that 2 years ago?
Look, again, we need harsher criminal penalties against those that are poisoning people, and that's exactly what this bill does. Do criminal penalties deter everybody from crime? If they did, we wouldn't have crime. They don't, but they're a tool in the toolbox that prosecutors need and that law enforcement needs to make sure that somebody who's poisoning community members is locked up for a long, long time.
Mr. Speaker,
Yeah.
we've heard about how difficult it can be to get treatment, and obviously, separately, the legislature is working on expanding substance abuse treatment, but how long will it be before people can have easy and accessible treatment for substance abuse? Like, how long is that going to take?
Yeah, I want to thank Representative Harrod and Representative Pedersen for their discussion about the amount of resources we're pouring into the mental and behavioral health care system across the state. You know, the difference here in this piece of legislation is that we are requiring that people who are suffering from fentanyl addiction to get an evaluation and to get that treatment. This is a unique way that Colorado has never moved forward on before to help those most in need suffering from substance abuse. I think that in combination with what's in the legislation that we're going to be introducing with all of the orbital bills, we're going to be in a place to make the most significant transformational change in Colorado's mental and behavioral health system in our history.
Do you think we'll see that substantially improved in a year or 2 years?
The timing is, listen, it's going to go as fast as possible. Those dollars are going to move immediately when the bills are signed into law. And so, it's not going to be tomorrow, especially when you're moving that amount of dollars, but it's going to be very, very fast. One more question. Faith.
Speaker, how does it at all play into this, the factor of intent? Like, let's say someone has pills they're selling,
Yeah.
they may not know that there's fentanyl in them. Does that
Yeah.
factor into their sentence?
Yeah, great question, Faith. So the question is, if you don't know you're dealing fentanyl, are you still held accountable for dealing fentanyl? And the answer is yes, and it should be that way because we cannot shield drug dealers from not knowing the deadly poisons that they're dealing. So yes, if you are dealing fentanyl, you're going to be held accountable for fentanyl. And when it comes to intent, we have a lot of district attorneys here. We've talked to a lot of law enforcement. Moving those cut points is going to help get to Tony's question and making sure that that person who has 20,000 pills is facing a DF1, which is very significant and includes mandatory sentencing. Thank you all very much for coming. Thanks to all the families and all the speakers.